Welcome everyone to the Best of Markham podcast, brought to you by me, Igor Klibanov of FitnessSolutionsPlus.ca, your personal trainers for chronic conditions. Here with me today is Sandra Edwards. Sandra, thank you so much for being here with me today. Tell us a bit about yourself.
Well, I'm happy to be here, Igor. I actually was born and raised in North Bay, Ontario. Don't know if you knew that.
Then,
My parents still live there, 92 and 93, live on their own by the lake. I was a kid who grew up in a rural environment. Three siblings, they're kind of world travelers. One is in Australia, Vancouver, and Panama.
wow,
Recently remarried. I have two kids. They both have partners, and I have three grandchildren and no dogs right now.
all right,
So
family.
yeah, I went to the University of Western Ontario in London, did my internship at St. Michael's Hospital, and have lots of different experiences aside from private practice nutrition, which I started 30 years ago. I also have been involved with quite a few other areas. So long-term care was my initial start. I worked in schools and worksite nutrition programs for healthier eating in cafeterias. I worked in a telehealth setting, counseling and supporting individuals across Ontario with nutrition questions. I also helped individuals in grocery stores. So private practice has been part-time. Now it's full-time for me.
Wow, so you got a wealth of experience.
Wealth of experience. Yes. I've seen a lot over the past 30 years.
Yeah, yeah. What was it like getting into private practice?
When I first started, it was honestly just my dentist and I having discussion. He had space in his office and said, "Why don't you start a practice?" And for me, that's how I got started. It was kind of like, why not? Let me do this part-time, see how it goes. I've been in 4 different clinic locations in Markham. But I wasn't the type of person that had to calculate everything out. It was like, okay, what do I need? What do I do? Who do I need to talk to? Let's start and see how it goes.
Wow, wow. And so, of course, you're not just a dietitian because you have to get your own clients. So, by definition, you're a freelancer, an entrepreneur. Um,
I am.
what do you do for marketing? How do you get new clients?
So online presence, sandraedwardsrd.com seems to be working well. I have a few yellow pages. I don't know how well that is going. Doctor referrals. I've been in practice for quite a number of years, so I will get some doctor's referrals, self referrals. People just Googling me. Honestly, they find me online somehow. So seems to be working for
Awesome.
now, anyway.
Yeah, it's great to have multiple ways of getting new clients. One is
Yeah,
doctor, one is Google, one is social media. So good for you.
yeah,
Of not relying on just a single source.
yeah,
Gives your business much more safety and stability.
for
Um,
sure.
what do you like most about dietetics?
The challenges. I think I've always had a passion for nutrition, for health, for eating well, for trying new things. But I think what I like the most is clients' comments. Honestly, the feedback I get from clients keeps me passionate, keeps me realizing the value I have as a dietitian, the value I have in helping and supporting others. We all don't have the same upbringing. We don't have the same education. It is a world of so much information overload. Most of my clients are like, I don't know who to turn to. I see this, my friend says this, take this supplement, take this. They are quite confused. And so I feel quite honored to have that role to support them in their health journey.
Is there like one or two real great success stories that really stand out in your mind without naming any names, obviously?
Um, yeah, I worked with a client who, over a period of 1 year or more, actually, um, and she honestly said, I saved her life, and I don't see it that way, but I guess I was helping and supporting her in a pivotal time within her life. So many challenges affect our eating, or affect our health, so to speak. And, we have work, we have family, we have pressures around us. And I felt that I had a gift to be able to support and guide her through that process. She ended up, walking, then ended up running, then she lost quite a lot of weight, but more importantly, was able to sort of summarize all the sort of, not all, but some key points of things that she remembered. She put it in a Christmas card, and it was quite touching.
Wow, wow, beautiful, beautiful. And what are you working on right now that's exciting to you?
Well, I'm really, really interested in the field of nutrigenomics. So nutrigenomics is looking at personalized nutrition according to your DNA.
Mhm.
We all don't respond the same to foods or to supplements. We don't have all the same needs. So I find that it's a really good way to kind of even more personalize information for an individual, and help them get motivated to embrace their health and embrace what they can learn and how they can apply those learnings to their own daily life.
Yeah, yeah. I mean, I see so much information and research about personalized medicine coming to the forefront and the interactions of, these people will respond to these medications or supplements or diets, whereas these people won't, even though it's the same diet, the person's different. So very, very exciting things coming down the pike. When did you start
Yeah.
genomics?
Yeah, so I started offering it 10 years ago. And so when I started, I work with a company called Nutrigenomics, based out of Toronto. So I'm comfortable with it being within the country. It's not available direct to consumer. So there has to be some education there. And there were 5 different genes that we looked at. Now there's 70.
Mhm.
It's only going to get better. I know the medication, they are learning, what medications could work better with an individual versus another. Skin health is another area. So it's just expanding. And as the research gets a little bit more robust, we're learning more all the time. So we'll be able to have further customizations, personalizations.
Yeah, and that's
Yeah.
exciting, especially for people
Mhm.
suffering from different chronic conditions, something that they've gone from professional to professional and nobody could figure it out. Well, maybe the answer is in their genes.
Could be.
Yeah, yeah.
Yeah.
What obstacles have you encountered in your time as a dietitian?
So when I started in private practice as a dietitian, there were very few private practice dietitians. So it wasn't well known. It was expected, oh, I can just see a dietitian at a hospital, can't I? Outpatient. Hmm. Services started to be cut and cut and cut. Obviously, I wanted to keep people out of the hospital. So certainly that was a challenge. There was not very much health benefit coverage. There is more now, although that's still growing. Challenges with understanding what a dietitian does. What is a dietitian versus a nutritionist? Dietitians are a regulated health profession. It's like going to a dentist or a doctor. We have a college of dietitians behind us to not only support us, but to protect the public.
Mhm.
Nutritionist in Ontario, the term nutritionist is not protected. So anybody with any kind of background can call themselves a nutritionist. So all dietitians are nutritionists, but that certainly is a challenge and an ongoing one. And lots of people I speak to are like, I've never done this before. And I think, I always offer a free consult.
Yeah,
So they get to, what are you looking for help with? What are your nutrition goals? And I'll see if they align with what I can support them with.
yeah, yeah. What do you
So
find are the public's biggest misperceptions about or misconceptions about dietitians?
that we put people on diets. I think that, in the term, the name, that was, what people thought. Nutritionist sounds a little bit nicer. I want to improve my nutrition.
Yeah,
But anyway, it is a protected term, and we are educating people, and there are more and more people who are looking for support and finding us too.
yeah. And so I know that for somebody who's watching this right now, they're thinking, my mind is blown. A dietitian does not put people on diets. How would you explain that to them?
Well, as I always say to my clients, I want to help you improve your eating habits.
Hmm.
Okay, so anybody can put a diet together. There's a zillion diets out there. It's a start and stop thing. It's a do and a don't thing. This is good. This is bad. I have to undo a whole lot of things in helping people progress forward. Although there are some good, sound diets, like a Mediterranean diet, it's a lifestyle that we want to really follow. And it's understanding, what choices people make, how they make them,
Hmm.
and if it becomes easier to make that healthier choice, they're on the right pathway. If I can help them change their taste buds so they don't want that chocolate bar,
Yes.
or that cookie is way too sweet, or they stop at one cookie instead of five, I've done my part in helping them progress on their journey. So it's really a journey and a lifestyle that we're trying to improve our eating habits to improve their health, whatever their goals are.
Yeah, yeah. And I love that approach. I mean, I'll often tell my clients there are a million different diets, and most of them agree that you should have more vegetables, more protein, less junk. Then why don't we follow it? Because information isn't motivation. The assumption that most diets make is that the problem is nutritional. That's only a surface level issue. The real deeper issues are emotional eating, stress eating, planning, cravings. These are the things
All
that
kinds of things.
people's
Mhm.
nutritional efforts or efforts to
Yeah,
stay on diet. And we don't
yeah,
solve emotional, logistical, behavioral problems with nutritional solutions. We solve them with behavioral, emotional, logistical solutions. So we're definitely very much on the same page.
yeah.
And what do you do in your free time?
Well, you may or may not know this, but I play a lot of tennis.
I do.
I play on a couple of ladies' tennis teams, competitive. I've recently taken up golf. I love golf.
Mhm.
And more recently, I've added weights. You'll be pleased to hear I've added weights to my regime. I also like reading. I do like experimenting in the kitchen.
Yeah.
I will try different things. I will try new things. My husband always says I'm a messy cook, so he calls me Emerald all the time. But I do like creating, and it's all sort of in line of healthy things, I
Yeah, yeah.
guess.
My wife and I play tennis about 3 or 4 times per week when it's warm enough out. I love tennis. Uh, Good
Yeah.
fun, a lot of running around. Yeah, break.
Yeah. My next step is getting into pickleball, but I haven't quite fit it in yet.
I think
So,
if you're good at tennis, pickleball will be a lot easier.
yeah.
Go to
Yeah.
sleep.
Lots of people. Yeah. I have some ladies I play with who play tennis every day. And I said, don't quite have time for that, but maybe when I retire.
Yeah, yeah, exactly. That's your retirement project.
Yeah.
And since
Yeah.
this is, after all, a Best of Markham podcast, what is your favorite business in Markham besides your own? So it could be a restaurant, a spa, a carpenter, lawyer, accountant, anything.
Yeah, so I'm going to say, because it's the winter time, and I love the Clubhouse Indoor Golf Simulator,
Oh,
16th and Markham Road, and Little Bangkok Thai restaurant. I love their red curry.
ooh, where's that?
That's Markham Road.
Oh, also Markham Road. Okay.
Yep,
Check.
yep. So it's like go to the simulator and then go out to have a nice bite to eat.
Oh, nice. Back to back.
Yeah, yeah.
Awesome. And last question, how can our viewers or listeners get in touch with you?
So visit my website, sandraedwardsrd.com. I do offer a free consult, and I do enjoy those to meet people to help see if it's a good fit for us working together, find out what their needs are. They can also email me, Sandra@sandraedwardsrd.com, or phone. The
Awesome.
traditional 416-937-1458.
That works as well. And I'll have all your contact information in the description attached to this episode. Sandra, thank you so much. I really appreciate it.
Great. Thanks so much, Igor. Had fun.
Likewise.